All right, thank you everyone for joining us for this particular session. So for this particular session, we'll talk more about the digital health, the impact, and then what sort of regulations govern the use of digital health solutions in the ASEAN regions, right? So with us, I think we have a strong team of panelists. On my left, I have Dr. Jeremy. So Dr. Jeremy, I want to introduce yourself.
Hi, and a very good afternoon to everyone and to everyone online. And my name is Jeremy. I'm a medical doctor, surgery, public health, and now quite actively involved in digital health, both as an investor as well as an operator.
Thanks, Jeremy. And then we have online our three guests. Maybe you can start with Roberta. Maybe you can introduce yourself in 2 sentences.
Hi, everyone. Nice to be here. Thank you for inviting me. I manage digital health activities at APAC Med, the trade association for the medtech in APAC. Thank you.
Thanks, Roberta. And then can we have Nathaniel as well? Nathaniel, can you introduce yourself in 2 sentences?
Hi, everyone. I'm Nathaniel. I'm the CEO of Hello Doctor. Hello Doctor is a leading health tech company in Indonesia. Provide a wide array of service for patients in integrated platform, what we call a super hub for healthcare. So we provide service starting from telemedicine, going from also medical content, offline doctor booking, e-pharmacy, and insurance services, building basically an all-in-one package for Indonesian patients to manage their health. Today, Hello Doctor is leading this market with more than 33 million monthly active users that will use our platform on a monthly basis.
Last but not least, can I have Andrew? Can you introduce yourself, Andrew?
Thanks very much. My name is Andrew Wong. I'm from Prudential, based in Hong Kong. So I'm the Chief Health Officer, looking after all the health initiatives, both in Asia and Africa. Over the last 2 years, we launched a mobile health ecosystem called Pulse, which I'm going to introduce and talk about that later on. Thanks a lot.
Myself, my name is Tiam. I'm a healthcare director from SAP. I'm the healthcare lead for the Southeast Asia region. So I think we all know about digital health solution, right? I was reading an article this morning from McKinsey that says that the adoption of telemedicine over the last year itself, right? There's a spike of over 72% from February to April last year. And then currently it stands at the adoption of telemedicine is about 32%, right? That shows that I think the pandemic has accelerated the adoption of digital health technologies. And then with the adoption of these digital health technologies, there's also a number of challenges, especially in terms of the regulations, the frameworks needed in place, right? To make sure that such technologies are safe and effective and then offers a quality and is able to be trusted as well. Testing. All right. So I think one of the things we want to discuss in today's session is to look into all these challenges and issues. And maybe I'll start off with Roberta, right? I think Roberta, APAC recently has just released a report, right, that mapped digital health regulations across Asia Pacific. So specifically, how does ASEAN countries stand in this report?
Yeah, thank you very much for the question. It's true. I mean, APAC Med is really active in the field of digital health in the, since the beginning of 2020, and specifically for the regulatory part, we are active in Asia Pacific and ASEAN for sure. So the report you mentioned was published at the beginning of this year. It's a study that we conducted on the way several regulators across Asia look at digital health. So we highlighted, best practices and gaps, and the objective is really to share and to, share knowledge, share the expertise of different markets, and allow, different countries to collaborate. So when it comes to ASEAN, of course, I will talk a bit more about Singapore, because Singapore is doing very well when it comes to regulating digital health. So it's a great example, and I think it's important to mention that they have several guidelines specific to digital health. This is not true for all the countries, right? So it's really innovative. They have alternative pathways for digital health. They have also allowed pre-submission consultations with companies, with digital health developers, with medical device manufacturers, and so on. And this is really important as well because it allows companies and the government, the regulators, to talk to each other before the submission is made. Also, Singapore has a specific framework for artificial intelligence. They have a guideline for safe development and implementation of AI in healthcare. And also they have a couple of guidelines for qualification of software as a medical device, which are really popular in the field of digital health. So they basically, with several examples, explain to companies when a software should be qualified as a medical device, because as we know, not all software should be regulated as medical device. In terms of classification and risk classification, this is also very important when it comes to digital health products that are used for patients' management and healthcare. So it's important to classify them in a way that is specific to software and digital health, rather than readapting or repurposing guidelines that have been developed for traditional medical devices. So Singapore recently, very recently, in the past few weeks, implemented some updates when it comes to risk classification, then aligning to the recommendation of the International Medical Device Regulatory Forum. So in a nutshell, these are just a few examples to share how one of the market is doing when it comes to regulating digital health. If we look at other ASEAN countries, for sure, digital health is a priority, and regulating digital health is a priority for all the ASEAN markets. However, we must say that specific and fit-for-purpose frameworks for digital health are not always present in other markets. So it will be really, really important that all the markets, collaborate and discuss. So that's, a bit the work that we are doing at APAC-Med, trying to facilitate this dialogue. So yeah, that's, I think that's a little bit about ASEAN.
Thanks for the review. Maybe I'll jump to Jeremy next, right? So Jeremy, you have a work on the personalized health index recently, right? Please share with us the findings and the recommendations from that.
Well, at the start of this year, there was unveiled a report on really personalized healthcare, and it was also similarly, it was an assessment of the various countries across Asia. And I do think that there were a couple of key lessons that came out of this. The first is that we're really behind the curve collectively, right? All of us need to recognize that healthcare is way past the one-size-fits-all stage. In virtually every other facet of life, consumer, entertainment, and e-commerce, we have moved into this really hyper-personalization. But healthcare, it is the laggard, right? So there is a lot that we do need to do to move forward. And I think COVID has also very richly demonstrated that we are different, right? That we respond differently to vaccines, to various interventions. And hence this era of really precision medicine is well and upon us, and it is needed. And maybe the third point that I'll make that hasn't been covered in really Roberto's earlier statements is really around responsible data sharing. Right? In May this year, we in the National University of Singapore organized a conference on really precision public health. And one of the key takeaways was that a little bit of data is good, a lot of data is much better. And this data resides in multiple pockets fragmented across the health ecosystem. And if we can develop guidelines, formulations on how to share data in responsible, ethical ways, patients benefit, society benefits, and that's something that we as a society, we established a Precision Public Health Asia Society after the conference to really take forward some of these ideas. And this notion of responsible data sharing is something that we're working very hard on.
Thanks for sharing. Maybe I'll jump to Nathaniel next. So Netana, as the CEO of Hello Doctor, right, which is the most widely used healthcare platform in Indonesia with over tens of millions of users. So how did the idea to create this platform came about, right? What are the gaps that you're hoping to plug into, and then what are the challenges you face also in terms of also the regulatory framework that you see in Indonesia?
We started the company in 2014, so well back, right, in 7 years ago. Suchi was my co-founder. She's Indonesian, and basically the problem we were seeing was quite simple. I mean, people were struggling with taking basic healthcare decision because there was a lack of access to information in general, right? So there was no website where you could find reliable information and simple content in local language. There was no way as well to communicate relatively fast with a doctor and get some information on the palm of your hand. So most people rely basically on what their neighbor will say, what their auntie will say, what they believe to be true, right? So we are seeing people struggling on very basic healthcare decision. And to add to that, I mean, in Indonesia, there may be also a widespread mistrust with the overall medical system, which means that people have a tendency to postpone as much as possible when to go see a doctor. So that was the very basic issue that we are seeing, and we are seeing people taking very bad healthcare decisions that in a normal environment where you have access to easy information that is reliable and up to date, you could solve in a few minutes, could become life-threatening in the situation of Indonesia in 2014, right? So we decided to build basically reliable content that people can at the same time easily understand and that is medically accurate, and also connect patients to doctors all around Indonesia within a few minutes, right? So today, if you use Hello Doctor, you can go into a platform wherever you are in Indonesia, and you can speak within 2 minutes to any type of doctor, any type of specialties on a platform, and that solves a lot of problem of accessibility and affordability for healthcare for many people all around the country. In terms of regulatory framework, what would be the issue? So let's say that the situation was a bit unclear up until COVID. I mean, telemedicine was maybe not perceived as being the top priority of regulators. So we had, like you have to often to do, right, when you are dealing with an innovative industry, it's like we had to speak a lot with the regulators and take our decision internally about what we can do, what we cannot do. Fortunately, with COVID, I mean, telemedicine and health tech in general has been much more on the spotlight of the regulators, right? So a lot more regulation came. We had a lot of partnership with the Ministry of Health, with the Doctors Association, with the local FDA, and so forth and so forth. So a lot of new regulation have come. It's not perfect yet, right? There's still a lot to be done, but it goes into the right direction. And I think that in Indonesia, there's a widespread, basically, belief today that telemedicine will be helpful for several reasons. Number one, in case of pandemic, right? I mean, you need to be able to access doctors and interact with doctors without going face to face for most issues. And telemedicine is the best way to make that happen. And second is like Indonesia is a very big country, and the doctors are spread in a very unevenly manner, meaning that most doctors are in big cities. So if you want to solve the access of doctors in a country like Indonesia, telemedicine is one of the best tools you have to solve the doctor access problem in the country, right? So for this reason, we find the regulators being very supportive. It's not perfect yet, right? There's still a lot, I think, that we can do to make the ecosystem more stable and more sustainable. But a lot of progress has been done over the last 18 months, and things are going into the right direction.
Thanks. And I jump to Andrew next. So Andrew, from the insurance industry perspective, right, how have the digital health technologies changed the game for the industry, especially in this current pandemic situation?
Yeah, thanks very much for the question. I just like to introduce Prudential is a life and health insurer. We operate in this region for almost 100 years. And in the past, same like other insurers, we tend to operate in a very conventional way. A lot of the setting jobs been done on face-to-face basis, and both the claims and underwriting process could be tedious in the past. And also bear in mind that insurance is a very low touch point business. So we don't really get in touch with our customers every day or even every week in the past. So with the evolution of the digital health technology, and especially during the pandemic, I think it's really a game changer for the industry and also for the customers as well in several aspects, both in terms of the way how we sell our products and also how we engage our customers from a very low touch point to a high frequency touch point basis, and also how people can make their claims through the digital means. So the outbreak of pandemic, of course, we all know that it basically doesn't allow people in the markets to move freely from point A to point B. And also a lot of the residents in this part of the world, they worry about going to see doctors at the clinics or hospitals because they worry about crossed infections. And some of the doctors, they also don't want to see that many patients as well. I think the use of technology, as you rightly mentioned at the beginning, that the use of telemedicine being on the rise dramatically over the last 12 months. But please bear in mind that telemedicine consultations is not, or it wasn't, a standardized coverage from the insurance industry perspective. So in the past, even if a lot of the companies, they provide outpatient coverage or specialist coverage, it needs to be done on a face-to-face basis in order to be considered reimbursable. But of course, a lot of us changed that during the pandemic due to the demand and due to the fact that it's getting more popular, and the technology would enable the telemedicine consultation to be done more effectively because of the clarity, because of the there's a lack of time lag as well. So other than the telemedicine, I think we also use tele-underwriting a lot more than in the past. So as I said before, in the past, the underwriting bit was probably done on a face-to-face basis, or a lot of documentations involved, and we need to send people to a clinic for medical examination. And now a lot of these can be done over the internet, or we can use other data in lieu of the medical examinations. And the use of the technology can also help us to tap into the new market segment as well. Bear in mind that a lot of the Gen XYZ, they are more technological savvy, and they like not only to get the information from the internet or from the app, but also they are in a position to make decisions and buy the products and services online via the app as well. And more importantly, more and more regulators allow the insurance companies to sell some of the more complicated products online and via the app. And I think it's a great revolution from both the insurance company's perspective and also the industry perspective.
So to continue on that, right, because now you're saying engaging with your customers digitally and then collecting data from them as well through online means or mobile applications. So what about the concerns about data privacy, right? Because I think most of the consumers there are of concern that I'm sharing more data with my insurance providers and all that. What would they actually do with the data, or would they really protect my data, right? How do you address these sort of concerns and then make them trust that engage our consumers to make them willing to share the data with you, and then trust that you're able to secure the data for them?
Yeah, it's again, it's a very good question. So I think we look at it in several ways, and of course, as an organization, responsible organization, we take the data privacy very seriously, and we are regulated in all the jurisdictions we operate. So we adopt the highest standard in terms of data privacy, in terms of data governance. This is the first consideration. So we only use the data we collect upon customers' consent or the user's consent. We never pass on any information to a third party without their consent. So that's point number one. And B, in terms of trust, we build our trust through our brand. We are trusted brand in the industry, We've been operating in this part of the world more than 100 years. And we also realized that we build the trust over different avenues, especially when people make claims. So we do honor our claims promise. We have a very transparent and empathetic way of dealing claims, because why people they make claims with the insurance company? Because they are in difficult moments. That's the moment of truth. So as a result, we are very conscious about the fact that we have to honor the promise we sold to our customers over a long period of time, and especially when they're having difficulties or when they have very difficult moments. So we only ask the minimum information, we only ask the necessary questions, we pay claims with empathy, and we are quick in terms of the turnaround time, pay claims as quickly as possible, we are transparent, and we treat our customers fairly. So I think data privacy, of course, is very important. We also need to build the trust with our customers through other means and channels as well.
Thanks for that. So maybe let me move back to Nathan now as well, right? Because again, Hello Doctor is a platform where your users get access to the medical guidance, doctor consultations by videos, text, and able to book appointments and so on. So how do you again ensure that the customers or your patients have access to data that is safe, verified, and then of quality information? I think you're on mute, Nathaniel.
My apologies, I didn't hear well. Can you please repeat?
Yeah, I think the question is, Hello Doctor is a platform, right, where your users is able to engage, to get medical guidance, to get a video consultations, and then able to make some appointments as well. So how do you ensure that the information that you provide to your consumers, your customers are safe, are verified, and then they are also quality information?
So in terms of safety of data, right? I mean, like it's a long work. You need to basically follow a lot of process and a lot of security process, right? Hello Doctor, we, for example, in the ending process of getting our ISO 27001 accreditation as to the overall safety of our platform. Is not demanded by the regulator, but we think it will be in the future. We think also that it's a good framework for us to ensure the security of all our platforms. So we are following this. We are also working closely with several security consultants. We have a security team inside Hello Doctor. All our teams are trained as it comes to data security, data privacy, and so forth, to make sure that we can control where data come and where data go on our site, right? So it's all a question of setting up the best practice and being proactively looking at any flow that could happen into our organization, right? So there's no no magic solution, right? Just demand a lot of work of organization. It's difficult when you start at the beginning, because I mean you don't have the resource. But as you scale, obviously, and you're dealing with more and more patient data and so forth, and it's very important to have very high security standard that you can't just rely on trust on your team to manage all of this.
Okay, thanks. Back to you, Jeremy, right? Because you mentioned about the progression to personalized health, and then so where does the region stand, right, compared to the rest of the world, and what are the key challenges as you move towards the personalized medicine that you see?
Maybe, Tiam, before I respond to that, can I go back to the data privacy question? And while I agree with my two fellow panelists, I do also think that we need to reassure that when the inevitable cybersecurity incident happens, the consequences are not devastating, right? I think none of us can say with absolute certainty that our systems will not be hacked, that there will not be breaches. And what's important then is that a couple of proof points, a couple of cases will then illustrate that even if there is a hack, right, very sensitive information is kept separately, the information is de-identified, and hence the consequences can be much better managed than if it was all in one big data dump. So I'm a bit more, how should we say, I'm a bit more pessimistic that all of us will sail through this era without event, and hence we really should fire drill this a couple more times. On your question around precision medicine, it's really what all of us have been talking about. We really have to start digitalizing a lot more information. And as you rightly pointed out, people, customers, patients will be much more willing to share information if they know that it's, number one, going to be used in meaningful ways for themselves. Okay, I'll be very candid that not too many people care about the greater good if the downside is to be borne exclusively by the individuals. So as we look at the big tech companies, we know that most of them will trawl our emails, review our search histories and so on, but it creates value for us, and therefore we are willing to take that risk. So beyond digitalizing, we also need to build those use cases that create value for the individuals who are contributing data. And I see this as almost a virtuous, almost as a virtuous cycle. There is a flywheel that the more data shared digitally, the stronger the use cases, the better it is for the customer, for the patient, and the more willing they are to share. And when the cybersecurity incidents happen, we manage them well so that overall it is not trust eroding, but it's confidence building.
Thanks. So over to you, Roberta, right? So there's a common consensus that the regulators need to keep up with the fast-paced innovation, especially in the software and technology space, right? So that they are able to innovate at the same pace as well. So that means that the partnerships within all the stakeholders are pretty important, right? So what do you see are the barriers or the areas for improvement for improving these stakeholders partnerships?
Yeah, thank you for the question. And I think we saw right in the discussion so far that partnership is very important. Public-private partnership is never easy, right? And when it comes to digital health, it's even more complex because of the number of stakeholders involved. So we have the traditional healthcare stakeholders, like the members of APAC-Med, the medtech and digital health companies, or the pharmaceutical companies, the regulators, the policymakers. But then we also have very active stakeholders that are kind of new. Tech companies, telecommunication companies, and then of course, insurers, payers, and so on. So we should allow all of these stakeholders to speak and to speak the same language, and it's not easy. And if we think about our region, then we have another degree of difficulty because as we know, the region is extremely heterogeneous from many different perspectives. So what works in one market might not work in another market. And when we have to facilitate partnerships across the industry and across the countries, then it's really hard to manage. So barriers, of course, are these. How can we overcome these hurdles? So our perspective from a trade association point of view is to really start simple, to do baby steps in order to allow all of the stakeholders to learn from each other and to build trust. So we hear a lot, from the other panelists, the word trust. This is very important when it comes to innovative solutions like digital health solutions. And we are working with the healthcare of patients. So of course we need to build trust and to be very, mindful about that. It requires time. So we started roughly 2 years ago. Now we have a number of collaboration ongoing with several stakeholders across the region, from policymakers to regulators across the markets. I think one point is really, starting by defining and aligning on definitions. Digital health is very difficult to define. If we look at several markets and several governments, policymakers, and regulators, sometimes they have different definition of digital health, and they also lack of consensus. So we should help these stakeholders to build consensus, and then we should help them to work together. And of course, there are some concepts like convergence and reliance that are very important. So I think it's really, really crucial that all the ASEAN member states, discuss and then work together to better regulate, these new technologies for better access to patients.
Maybe a further question to that, right? So based on experience so far, right, what are some of the best practices you see, right, that are in place right now governing digital health that we can emulate here for ASEAN?
I think I missed the first part. If it was for me, I missed the first part of the question. Sorry, the audio was a bit low.
The question is, what are some of the best practices that are in place, right, that you've seen as governing digital health that can be applied or emulated here in ASEAN?
Yeah, sure. So I think it's really important to look at what other markets are doing, and that's our approach as well. When we facilitate knowledge sharing, we always start from what exists, then we analyze best practices, and we try to share with other markets so that they can learn from the experience of other countries as well. So there are numbers, and of course I'm not going into the details of all of them, but what the regulators in ASEAN could do is, number one, clearly describe digital health. And when we think about software, for example, when a software should be considered a medical device, in this case, they could look, for example, at the best practices from 3 markets: US, Australia, and Canada. They're doing quite well. Then, of course, one other point is regulating digital health in a specific way. What does it mean? It means that we should not look at digital health as a traditional, technology from, as a drug or a medical device. We should really implement regulations that are fit for purpose for digital health. So that's also very important. There are a number of countries that are doing that already, and there are some recommendations from the IMDRF, the International Medical Device Regulatory Forum, that countries can, emulate. There is also another point when we look at apps or software or other type of digital health products. Sometimes these products have multiple functions. Of course, regulators should not regulate all the functions of the product, but only the function that has a medical device intended use. So that's also very important. Otherwise, we add burden, and we don't want that. We want to regulate in a safe and effective way, but we should make the process smooth. And then another point, and I mentioned that already in the previous answer: recognition and reliance. This is something that countries can easily apply. Think about ASEAN. Imagine one country has already reviewed and approved a digital health solution, platform, whatever kind of digital health product. Then other ASEAN member states can rely on the work done by that regulator and use it for to provide access to his own citizens. And then I think the last point is really important, is around collaboration and partnership. So I see that in Singapore, what is working very well from a company perspective, but also from a regulator perspective, is the opportunity for private and public stakeholders to discuss in advance. So you should not arrive there and just submit your document for the regulatory approval without knowing what exactly the regulator is looking for, and vice versa. Regulators should also discuss with companies, trying to explain what kind of data do they need in order to approve a digital health product. So I think these are some of the examples and very actionable steps that all the markets can implement moving forward.
Thanks for the views. Back to you, Jeremy. So as a public healthcare expert, right, so what are the biggest threats you see, right, if the regulations that govern the digital health technologies are not robust enough? And if not properly regulated, right, digital health technologies could widen the digital divide between people access to all people.
Maybe Tim, let me correct you first. There are no real experts. Everyone is trying to figure out as best they can. So we all just keep learning together. on your question around the downside, I mean, I would say that the inevitable and sad reality is that we live in a world of haves and have-nots, right? We cannot hold back those who want digital access and all the upside, and we have to actively and very proactively push for rapid diffusion of these practices. So if we look at most other technologies, it follows a fairly typical really adoption curve. The ones with means, the ones with privileged access get these technologies first. But after this happens, smarter people than myself will figure out how to deliver the same thing more cheaply and more accessible, and then everyone else gets it. So I am a very pragmatic guy. The world is what it is. So I would just urge policymakers to do two things. One, push for rapid adoption. Once something works, just like what Minister Ong said earlier, once we figure out over the next 2 to 3 weeks that it's working or it's not working, then quickly introduce the regulations or the activities that will allow us to scale rapidly. And the second thing is watch for health equity, right? It's the government's job to not look after the rich people. The rich people can look after themselves, but it's the government's job to look after the rest of society. And that's where regulations, subsidized access, and so on become important.
Okay, thanks. And a question for you, Nathan, now, right? So, do you hope that the healthcare startups and digital healthcare can replace the face-to-face consultation, right? Especially for minor ailments, and then especially also to provide healthcare to those people, populations in the rural areas that have little access to healthcare facilities? I think you're on mute, Nathan.
Apologies once again. So yeah, on our side, we believe that telemedicine is going to replace most of consultation in the long run. Yeah, and for several reasons, right? The number one, obviously, is like the obvious convenience, the obvious fact that you can discuss, you can access from everywhere. Number two is that you're going to have, we believe, a revolution in the next few years in telemedicine, is that you're going to be able to do a lot of remote diagnosis from your phone, which is maybe not possible today, that demands maybe a lot of IoT. But you have a lot of companies all around the world developing amazing technology where a lot of your biometrics will be basically detectable from your smartphone using audio or video. In Hello Doctor, we are starting integrating with some of them. They're super impressive. The guys start to get approval from authorities to get it as medical device, and there's going to be a revolution over the next few years in healthcare, meaning that a lot of what you can do, especially in primary care, will be doable from a remote setting, right? Will you be able to do everything? Obviously not, but a very large part will be doable from online. The other piece is that, and it's something that's already happening in China a lot, we are also implementing similar things in Indonesia, is the support of AI. So we discussed about medical record and so forth. So when it comes to an application and not face-to-face, you have a lot of information that is like structured. On Hello Doctor, I mean, we are a big believer in chat, a little bit similar to what's happening in China once again. And with chat, you have a lot of structured data, and AI comes to play a huge role in the way teleconsultation are evolving today, right? So we are not replacing doctor, but basically AI is constantly supporting the doctor as to which question to ask, what to recommend to the patient, what to prescribe in the patient, where to refer the patient, and so forth and so forth. And you have the development basically of what we call the cyber doctor, meaning a doctor that is not what you will experience when you're face-to-face, the doctor that is supplemented in real time by an AI that is making recommendation to the doctor, right? And the level of medical accuracy, the level of also process that you can remember with an AI is like much higher than when you are face-to-face with a doctor, right? So doctor supplemented by AI, remote diagnostics as well, artificial intelligence are going to create a real revolution in telemedicine and health tech in the coming years. And we don't believe that telemedicine is going to remain a complement to offline medicine. we believe that telemedicine is going to be the central part of medicine. And then face-to-face medicine will be for the few things where you cannot do it face-to-face. So obviously, a surgery you cannot do at home. You will have some MRI will be very hard to do at home as well, right? You will have a lot of things that you still need to go to the hospital to do too. But I say that for the great majority of consultation, a very large part of it will be doable online telemedicine, and will play an absolutely key role in the medicine of tomorrow.
Thanks. And maybe over to Andrew, right? So I think now we are moving towards an era of prescription-based digital therapeutic apps. In fact, Germany last year, right, they are the first country to approve the reimbursements for digital, for prescription-based digital therapeutic apps itself. That means instead of the doctor prescribing you the medication itself, it can prescribe you the use of this particular app, right? And then that can be reimbursed. So do you think this this trend will start happening over here in this particular region as well? And then from the insurance industry point of view, right, what are the things they need to consider before you look into reimbursing the use of this digital therapeutic apps itself?
Yeah, I think this is quite a complicated question, because it doesn't only impact on the insurance industry, but it also has impact on the medical profession as well. So at the moment, all the health products and services we provide, especially on the medical reimbursement products, we cover on the basis that they incurred on a medically necessary basis, and then there are respective definitions in terms of who can prescribe and who has the qualification to treat the patients and all that. So not until when the respective MOH they approve the use of such application, then I think the insurer will be in a better position to make the decision what is payable and not is not payable. So that was what I highlighted earlier in terms of the telemedicine consultation as well. So in the past, because it was not that popular, because it had certain limitation in the use of the telemedicine, so telemedicine consultation was not even a part of the reimbursement program from the life and health insurance perspective. And of course, it changed recently. So I think we need to work together with the regulator and also with other industry players as well and other relevant stakeholders in order to move things forward, in order to work best for our customers in this part of the world. So we need to work collectively. We can't be a silo. And also, having said that, I think technology is a business enabler. So at the end of the day, we need to play the customer-centric role to find out what is needed and what is required by our customer. And that's why, from the Prudential perspective, we launched Pulse by Prudential in the region 2 years ago. And the aim is to provide the users in this region to have access to affordable and quality healthcare. So one more point to add is about regulatory requirements or regulators in this part of the world about medical devices. So when we launched Pulse 2 years ago, of course, we did go and meet up with various regulators, whether they are health ministers or directors responsible for registration of medical device. And we are aware that within the ASEAN communities, there are a lot of similarities in terms of the classification of medical devices. But again, it's a real-life example. When we take the same application to see different regulators in the region, they may come up with different classifications for the same app or same medical device. So there are a bit of inconsistency, even by when you look at the wording, they're pretty much similar or exactly the same. So I think one thing can help to speed up the rollout of the digital health in this region is to have more alignment within among the regulators, and also more dialogue is needed. And I think we need to work closer with them as well.
Thanks. I think we have about 6 minutes left. I'd like to open the floor, questions to the floor. Does anyone in the audience have any questions to ask our panelists? Any questions? Do we have, does any of the audience online have any questions as well? If you have, can you put it into the Q&A box? if there's no questions, maybe I'll just ask this from the panelists. Right? Maybe want to summarize from each of you 1 or 2 sentences what can from your industry or your perspective point of view, right? From the public health perspective, consumer industry perspective, and so on. What can your industry do to encourage the adoption of digital health technologies? Maybe starting with Jeremy, since you're next to me.
Yeah. I think, as has been said, nothing is more powerful than an idea whose time has come. It's very clear that the idea of digital health is fully blossomed during COVID. That said, it's almost like the current regulatory framework, the current reimbursements are really a bit like emergency surgery. It's in crisis that all these have been, and now what we need to do is, if I take this very trite term, we need to build, but not back better. We need to build forward better. We need to seize the opportunity of the crisis to really embed and anchor a lot of the regulatory changes, the really reimbursement changes. Otherwise, we lose the opportunity. I think Janil in the previous session shared he was a young doctor during SARS. I was also a young doctor during SARS. We're both not young anymore. But SARS was really a missed opportunity because it disappeared after about 6 months. Back in 2003, we really had tele consultations, we had tele everything, but because SARS came and went so quickly, we lapsed back into our bad habits. And so 17 years later, we are rediscovering the lessons we should have learned 17 years ago. Back to you.
Thanks. Maybe Nathaniel, you want to share a view as well?
Yeah, I think it's all about the quality of the service that is provided. So if patients have the feeling that patient, doctor, hospital have the feeling that the solution is better for them, people will move toward that direction, right? So better in terms of quality of service, quality of care, convenience, access, and obviously price, right? So I always believe it's like up to the player in the market to provide services that are as good as possible. And if people are not shifting fast enough, it means that what we are providing as a service is not good enough. At the moment, if people are moving fast to a service, it means that we are solving a pain point, solving a problem that is basically shifting consumer demand.
Thanks. Maybe Roberta, can you share a viewpoint from the Medical Technology Association point of view?
Yeah, sure. I think a few things. Education for sure, education and skills, trust, collaboration, and then from the perspective of a trade association, definitely. It's really important to implement policies that are specific for digital health. So from a regulatory point of view, I think we are more advanced in the region and worldwide. From a reimbursement, there is a lot of work to do. So the example of Germany was mentioned earlier. So we look very closely at Germany because they're doing a good job, but still, it's not perfect. What is really missing from our perspective is a framework that can provide some guidelines to insurers, to governments, in the way they can cover digital health. Otherwise, they will be never affordable for patients and for the society, and there will be, they will be stuck. They will be approved by regulators, but not used as they should because no one will cover them. So I think that's really, really important. And it's a lot of work, but it will come in the future.
All right, thanks. Do we still have Andrew on the line? No. Okay. So do we have any other questions from the audience that you want to ask the panelists? So maybe ask Jeremy a question then. What is your point of view on prescription-based digital therapeutic apps itself? Like, do you see there's regulations needed, like clinical trials needed for such things before the approval?
I would say yes. Software as a medical device has started to mature a little bit under the US FDA regulations. I do fear that this part of the world will be very behind and that clinical practice will run ahead of regulations. But that's not really a bad thing as long as regulators recognize that they are behind the curve and permit things like regulatory sandboxes so that innovation can continue as well as the collection of real-world evidence. So, and eventually ASEAN will catch up.
Okay. So, Nathaniel, from a startup point of view as well, right? Where do you see, do you see a future where you may evolve into something, your application will evolve into something that's prescribed by doctors to be used, like for managing chronic conditions, for example? Nathaniel, that question is for you. Do you see Allo Doctor evolving in the future to be something like a prescription-based application, right? Where doctors can prescribe it for patients to manage their chronic conditions? And what does it take for you to get there?
So it's already the case. I mean, it's already the case. I mean, we have approximately 40 to 50% of our teleconsultation that will end up into a prescription on our site. So we already have diagnosis and prescribing capabilities. Obviously, you cannot do all the case, right? We are referring to offline capabilities in 10 or 15% of our telemedicine case. But you have a very large amount of case that already can be managed fully online, right? So that's something that we are already actively doing. That is already positively regulated by the government, and that is already very helpful, both from the doctor side and the patient side.
I'll ask you to wrap it up, please. Thank you, because the next session is coming up.
Sure.
Thank you.
All right.
Thank you very much.
All right. Thank you so much, panelists.